好，大家好，欢迎收看。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health.
今天是7月20号，为大家现场带来BC 省这个新冠疫情的最新新闻通报。
Here on the territories of the Lekwungen-speaking people, the Songhees.
那么也是按照法律，也是惯例，也要感谢原住民提供给我们这个土地，我们现在享有的一切不要忘记他们。
Tomorrow at 3 o'clock, we will be presenting a written
明天是书面通知。
And with that, I'm honored to introduce Dr. Bonnie Henry.
今天现在是 Bonnie Henry， 今天是周一，会有2个阶段的。
So we have a number of things on the agenda today. To start with the case updates since Friday. We have 3 reporting periods. Between Friday and Saturday, we had an additional 51 cases in BC. From Saturday to Sunday, 19 cases. And from Sunday to today, 32 people who tested positive, giving us a total of 102 new cases since Friday, 4 of whom were epi-linked. That brings our total number of people with COVID-19 in British Columbia to 3,300.
3,300个了总数。
All health authorities have been affected in the past weekend. We now have 1,042 people in Vancouver Coastal Health, 1,713 people in the Fraser Health Region, 142 people on Vancouver Island, 280 people in the Interior Health Region, and 69 people in the Northern Health Region, as well as 54 people who reside outside of Canada.
Okay.
And I've had some questions about that category from some people, but to remind people that that is people who might have been positive while they were here visiting, or people like temporary foreign workers who are here for a defined period of time. And that's from the beginning of the outbreak. We've had 54 people who met that category. And as I mentioned, we have had cases this weekend in all health authorities in British Columbia, which reminds us the fact that this virus continues to circulate. And as we are moving, we are bringing it with us. Although a good number of these cases over the last number of days have been related to a number of events and parties in the Kelowna area where people have moved from other parts of BC and other parts of Canada and then gone back.
其包括其他省或者是我们在它聚集下来的。那么现在是253个，其中16个住院，4个重症监护，好，没有零死亡。好，189个死亡，还是这样啊。
Additionally, we have 2,858 people who have recovered from the virus. We continue to have 3 active outbreaks in our healthcare system, 1 in long-term care and 2 in acute care. That brings our total of number of people affected in healthcare system to 657,
那么现在是居民有600多个啊，那么包括657个那个，其中呢401个居民，257个是职员。那么也是始终告诉我们社区的爆发的社区感染还是始终存在。那么一直在科罗纳温哥华岛上都有。所以大家也要记住，如果你去过最近如果有飞过查过飞机的，都要去向我们 BC CDC 那向我们汇报，向我们联系，由我们联系啊。那么大家也都时常关注我们 BC CDC 公布的一些警报。
In the Northern Health Region, there continues to be the 1 case related to that, and we now have over 60 cases related to the multiple exposures.
所以我们现在至少有超过60例都是跟 Kelowna 那边的爆发有相关。那么另外一个呢，我们还会详细的说今天那么这个我们今天说的这个抗体的情况我们上次说过，今天会给大家汇报一下我们之前完成了35万份答卷这个民意调查的数据整理，我们也可以看看这个病毒对人们的生活的影响。
To the end of last week, where we were up to 3,028 total cases. There were 72 new cases. As we can see, the median age still is around, so that's the most common age. The median age is still around 50, and about a little over half were women. We have not yet seen that sort of change that we've seen in other parts of the country of younger people being more affected. Having said that, we know that many, most of the cases that have arisen over the last weekend and the last few days have been in people in their 20s and 30s. So I expect that number will change in the coming weeks. We had 2 new people hospitalized last week. Again, a very small percentage in hospital currently. And as of July 9th, when this data was prepared, we had 186 people who had died. Again,
6月28号到7月2号的数据啊，那么这2个礼拜因为数据都没有。
This is the latest epidemic curve.
所以这个是最新的一个曲线，它还没给我们看到了这个曲线。这个看得清楚了，从3月份一直到我没看清楚是几月份，应该是7月9号，7月9号，同志们，直到7月9号啊，第1阶段、第2阶段、第3阶段，他说始终看到了我们这个曲线肯定是拉平的那么慢慢总归会有一些包括一些社区的零星爆发。那么我们也看到了每天的新增数据会有增加。这个也是看到了。那么这个也是我们那个疫情的曲线。那么这个呢是表明我们 BC 省所有的疫情到现在为止哪里来的？这个绿色的呢是国际旅行到达的，这个最多的紫色的呢就是本地传播的，还有一个第4部分的是什么呢？就是不知道来源的传播，还有灰色的，这个看不清楚。应该看到了 pending 就是还没决定的因为来不及分析。
The other important thing to note in this is that we are starting to see people who are testing positive in the last few days having a large number of contacts again.
那么他说到了过去几天看到了测试阳性的都是表明了都是在外面大量的接触引起的。因为我们现在说实话，他说每一个例子我们都会详细跟踪。我们相当清楚随着大家的这个活动的增加，这个病毒的会新增数量会增加，所以这个对大家来讲都是一个挑战。所以我们所以我们现在看到了一个小区，就是大家的聚集、开 party 等等，都是这些包括旅馆这个度假村等等。所以这些里边呢，大家亲密的接触、近距离的接触或者是也不管是外面还是室内还是室外，只要是大家长时间的近距离接触这些呢导致了人容易的这个病毒的传播，所以这个对我们的公卫系统的人员来讲是一个挑战，因为我们要面临很大的这个工作量去接触，连跟踪联系他们。
Today as well, I wanted to present
所以今天我还要给大家提供一些数据。那么主要是那些重病的以及死亡的案例的，这个是看到了总共一共是183个死亡，那个是7月2号的时候的那么这个我们的死亡率是6.1%，这个呢其中呢那么这个也是根据
So overall, and if this data goes back to July 9th,
这个是7月9号的时候，那时候是2978例里边183个，那么这个死亡率是6.1%。
So that gives a case fatality rate of about 6%. But if we break that down, we know that in some situations it's much more dangerous and much more lethal. So non-outbreak cases, so those are people who are infected in the community, either
它是
through
分布了，
travel
一个是
or
爆发的，
through
一个是不是爆发的。你看，爆发感染的是133个死亡，不是爆发感染的死亡是50个。
So the case fatality rate
所以这个爆发感染死亡率很高，12.9%。他说了，那么这个也是比流感高。那么，但是有些地方，比如说不是爆发感染的死亡率比流感低。那么大家可以看到了，这个长期护理院109个死亡，其中539个阳性案例就有109个死亡，占了20.2%。那么还有呢，就是长期急性病诊疗所，98例里边有22例死亡，这都是他说很高的死亡率。
Very high.
相当高，
so we know that about 1 in 5 people who are infected
所以5个人感染里边就有1个死亡，死于新冠病毒。所以我们也是表明了为什么我们花了很长的时间在调整长期护理院他们的这个工作那个隔离
Although the numbers thankfully are smaller.
那么因为急诊诊疗所呢绝对数字比较小，但是这个相对死亡率也很高主要是这个重症监护，因为他们还有其他的病导致的这个死亡我再说明一下，在西方加拿大和美国这个都是属于新冠死亡，其他国家我不知道，中国不是的。那么只要是在这儿呢，只要是新冠引起的死亡，不管是心脏病还是糖尿病，这个就是说到了98个案例里边有22个主要都是在重症监护死亡的，这却全部是在加拿大全部归类于新冠死亡。那么其他因素低于1%，可以看出来死亡率很低。
I also want to bring us up to date
那么今天也可以给大家模型再更新一下那么希望如何我们再继续的把我们的曲线拉平。
So this is the update of the dynamic
这个也是一个动态的模型分析。
What we can see from this though is that we're starting to see an upward bend.
我们看到了从这个曲线的拉平来看，又是往上走了。如果我们要继续能够让这个曲线拉平的话，我们只能是降低我们的接触的人。
Have a possibility of having explosive growth in our outbreak here.
这个也是看到了我们那个曲线的这个上升的趋势。如果大家不小心的话，还会往上走。他说我上次我们已经说过，这个是不确定的。现在因为现在我们都在一个舒适区里边了，现在大家又舒适区里边了，然后开始病情又开始往上走了。所以这个我们每天所做的自己的事情都能表明在曲线的高和低上。
So how many people we transmit this virus to if we're infected, and we can see again it has risen above 1.
基本上还是超过1个人，这个也是就是1个病人传几个人的一个曲线。那么从3月份开始，一直到了4月份、5月份、6月份都在低于1个人，6月初开始又是高于1个人，看到了吗？就是1个人传1个人，现在还是在往上走。这个到7月份又有一个往上走。他说这个还是只是一个模型，给大家告诉大家一个过去我们怎么走过来的。这个也是告诉，这个是好又来了，这个是50%、70%就是我们现在60%、80%，这个100%就是平时的大家的接触量。那么如果降低一半，你看的这个曲线，70%是什么曲线？60%是什么曲线？我们现在看到了吗？我们的这个也是开始了我们现在我们的焦虑所在。
It is something that we can make a difference in if we pay attention.
如果我们注意到的话，我们可以改变这个曲线的。所以大家还是要这个时刻保持警惕。
A slide that shows the Sero survey that we presented on Friday.
这个是
这
个我们收回的民意答卷的里边的答案，我们的收集的情况。
This is good news. This tells us that the things that we did
这个是告诉我们过去的我们的这个行为，这个是好行为，这个也是好消息。
In our interactions now, as we continue on our restarting of our economy and our community.
这个他也是说到了，这是我们社区感染低于1%。始终是低于1%，这个是好消息啊！所以说我们没有社区感染，我们主要还是聚集性感染，大家什么 party 啦，什么去搞活动啦，那么这个也是根据我们人口来的百分比，根据地理位置5个卫生局下面的这个4%啊，28%、25%啊，大家看到了吗？飞沙卫生局是25%不是最高，但是是最高的，对，面积最大的是内陆卫生局和北部卫生局面积最大，但是4%、14%，飞沙是29%。
Essentially, 1 in 10 adult British Columbians completed the survey.
他说我们10个人里边有1个人的省民都完成了民意答卷。今天他也喝水了，我也喝水了，可能今天是比较热。
Slightly underrepresented from the north, but there's things that we can do statistically to help make that a representative understanding of the responses. This is some data now that tells us the difference between the people who responded to the survey and our population in British Columbia. So it tells us, is the people that responded similar or different to our population? And then it gives you an idea of what we can do statistically to weight it so it is representative. And with the numbers that we've had, this large database, this allows us to be able to compensate for areas that we may not have had as many people.
人完成的最多，我们中国人第2 ，good， 我们中国人第2完成的答卷调查了完成的第2啊。那么这个呢，第3列呢是2016年的这个加拿大统计局的数字，那么白人是65%，我们华裔是11%，所以这个也是很好的一个情况，我们华裔做得很好啊，这个是4.5%完成了，这个也是好的事情，我们作为华裔也是感到骄傲的。那么这里边这个第2列呢是权重，就是他们完成这个完成答卷之后，那么要采样的权重。那么洋人他们79.7%，我们华裔4.5%。
Indicators like income and education.
那么这个里没有告诉大家收入啊，以及教育程度没有说。
Particularly with the experience of the measures that were put in place to stop the transmission of the virus. So to give you a few basic ideas
所以这个也是给大家一些基本的一个思路。
4 in British Columbia approved of the response that we had in public health here in BC. However, for younger people, this was less. Fewer younger adults felt the public health response was appropriate. And we're talking about younger adults being more differentially affected. And some of that comes in the further data that we're looking at. When we look at whether people were following public health advice, I think it's reflected in the low numbers that we've had overall in our sero survey that most people were taking the advice that we asked you to do and that we told you why we needed it to happen. So things like washing your hands, staying away from others when you're sick, avoiding gatherings, staying home when you're sick. And we did ask the question about, do you have the means to stay home if you're sick? This speaks to things like having sick leave at work or having a culture at your work that allows you to stay away when you're ill. And we can see that 2/3 of people did, but a certain group of people did not. And we need to address what we can do to make sure that that important measure is something everybody can take as we're moving through the next few months of this pandemic.
79%的呢是生病的时候呢，不舒服的呢在家里。
The biggest challenges were being created here from the response to the pandemic.
那么这个里边呢，47%的呢，就是有精神或者心理病的呢，这个47%更加坏了。那么还有呢，33%的人呢，觉得就是看医生更难了。15%的人呢，就觉得哎呦，我这个好像没有吃了，买不起食物了。那么15%的人呢，就是不能工作了。62%的人呢，更加关心的是家庭成员里边老年人啊，这种长期病的人啊，这些特别受攻击的人，病毒攻击。那么5%的人呢，他们说觉得不能动了，不能到处走来走去了。那么69%的人呢，就觉得因为这个新冠来了我们这个上班不舒服了。这个，那么31%的呢，觉得就是在财政上会有困难蛮厉害了。就是新冠疫情来了，有31%的人觉得财政困难了。我相信这个数字还是比较保守的。
69% of people felt that there's some impairment to their work, challenges in their work related to COVID or to the measures that were implemented to try and deal with the pandemic.
因为这次新冠病毒来了之后，上班不舒服了这个不舒服，这个限制那个限制那么60%他也是说到了，很多人就更加关心自己家里边有老年人啊，或者是受病毒攻击的人。那么现在31%的就是可能财务上捉襟见肘。
So that is just a small sampling.
那么这个是一些都是小概率的这个给不是小概率小样本的给大家看了。然后呢，现在就是主要是给大家看看18到29岁的这些人主要是他们一个是经济上的，第二个经济负担，第二个就是精神和心理上的压力，健康问题。
Because of COVID-19.
他们的失业率达到了50%，这个年龄段失业率达到50%。
And food services, and 1 in 3 were in the retail areas, and we know that those are the areas that have been dramatically impacted.
主要因为这些人主要都是在零售业打工之类的，大家都知道，因为零售业这个次受到疫情冲击很大。所以这个也能理解。
These areas of the sectors of our economy and of our communities. Younger people were more likely to report decreased mental health, increased difficulty accessing counseling, not working, difficulty meeting their financial needs.
所以他们都有困难在财务上因为不能上班所以都比较有困难。然后呢，他们也是有这个在这个取得咨询方面也是有困难。他们的这个精神健康方面，这个困难特别大，财务上的困难也特别大。
Families with children, and they as well report a greater mental health and economic burden than other adults with children.
那么这个呢是有小孩的家庭，他们在这个经济负担以及这个心理健康方面，有52%也是52%的人。这个是这个，然后呢，又是这个额外的困难、焦虑，或者呢睡眠时间减少等等。那么现在结论来了。那么他也是看到了这次新冠病毒对我们这个已经造成了很大的挑战。那么这个民意调查呢，也经是使得了我们能够如何采取平衡的政策，让他们又工作、学习相互联系，同时又要安全。所以这个他说了，这个民意调查一定是给了很多他们在今后决策方面参考的意见，取得了这个重要的一个参考。所以他说，我们现在已经压平了曲线，但是我们也是这个，我们也成功的这个迎接了这些挑战。我们必须还是要坚持继续下去。当然，我们也会用这个民意调查的答卷来指导我们接下来的进一步的政策调整。
and connect with our loved ones, and the importance that also has in keeping us healthy as a community.
那么最重要的是，我们主要还是要大家能够保持自己的安全和社区的安全。同时呢，他说我们也要学习啊、工作啊、相互之间联系啊。
Today's snapshot, early snapshot. Many British Columbians have experienced worsening mental health as a result of this pandemic. I think this is a surprise to no one. Many have also experienced additional economic burden, and young people have experienced greater impacts than many others in the population. I've also been very heartened by the resiliency that we have seen through some of the survey results, and we're still in the process of analyzing them, but particularly older people. Our elders and seniors have a sense of resiliency that makes me heartened for how we can support each other getting through this. The epidemiologic data also shows that we are at a turning point. We have
那么他也是说到了这些，现在是我们是最关键的时候，我们的转折点。
In our infection rate, our reproduction rate.
所以，如果我们放松，这个曲线就会往上走。
That might go up, but is in our hands to control.
那么，同时，这个控制权又在我们手上。如果我们相互交流接触太多，那么我们这个曲线一定会往上走，还会反弹。
We must acknowledge that the number of new cases reported over the last 3 days is concerning. We have not had 100 cases. Reported in a single time period.
这个是第一次
We have been
报了
very effective
超过了
public health teams in containing the
这个
spread.
是始终
But
告
we
诉我
all
们，
need to do our part.
我们必
And
须
this is a warning to us.
这个也是给我们一个
We
警
need to
告。
be the voice of care
所以我
with
们
our family and our
一
friends
定要
to remind
关注我
everybody
们，关
that
注
we
我们的
can
家庭成
increase
员，
our
关注我
contacts.
们的
We
朋友
can。continue to increase our economic, our travel.
如
But
果
we
我们
need
在
to do
增加我
it
们的经济
safely.
活
And we
动，增
know
加
how
我
to
们的
do
流
that.
通。
We have done that in BC, and we can go back to doing that.
那么
As
这样
I
的
said
曲
on
线就会
Friday,
上
I'm
升
not。typically very active on social
所以
media, but I am asking you again, particularly young
特
people,
别是年纪
because we
轻的
know
人
you have been
我
impacted
们
by
知道
this.
你们在这
Be
过
my
去受到
voice
很
on
多
social
很多
media.
的冲击，
Use your influence to
利用
share
你
a
们的
message
影
with your
响
friends and
分
your
享你们的
connections.
经验，
Don't let COVID-19 spoil our summer.
不要让这个
We can
新冠
play
病毒
safe and
随着
stay
你们的这
And we
个
know
活
what we
力
have
到
to
处
do
传播
to do that.
你们能够做得到。
There are a few things we all need to do to push that curve back down
我们
again.
一定会把这
They
个
go
曲
back
线
to the
拉
things we've
平。
been talking about. Fewer faces, bigger
所以我们
spaces,
还是要
using
少
our
见人，
layers of protection.
我们还要
Keep
多
your
增
groups
防
small.
护。
Only spend time with those you know.
如果
Focus on your friends.
只关注你的
Focus on
朋
your
友，
family.
只关注你认识的人。
The more people you see, the more likely it is that
如果
someone
你
will
见
have
的人多，那
COVID-19
么
and
病
spread
毒
it to
传播
you
的
and
机
the
会就
people
会
that you are
大，
close
对吧？
to.
你会
If
传给
you're
人家，
going
人家
out,
会通过传
be
你传给
considerate of the
别
people
人
who。are working in those places, in the restaurants, in the pubs that you are visiting, in the resorts where you are staying. Understand that the people who work there are at higher risk because they are looking after many other people. So be kind
所以
and show gratitude as they follow the WorkSafe BC requirements
所
for
以也是
safe
在上班的是，
operations.
也是要
We
大家
have
遵守
COVID
这
plans,
个
COVID safety
遵
plans
守
for
我
a
们的
reason. And we all need to
WorkSafe
follow
BC，
those rules
然
to
后
keep
呢
each other
也是
safe.
让大家
Don't
相互
ask
安
your
全，
server to bend the rules. Rather, help them by bending
不
our
要
curve.
去
Ensure
破
your
坏规
groups are no
则，
longer
不要
no
为
larger than 6 people. If in a restaurant,
如果
or
你
a
在餐
pub,
厅里边，也不
no
要超过
table
一个
hopping, and
餐桌
always,
6个人。
always stay away, stay home
始
if
终
you're
的
not，
如
feeling
果你
well.
不舒服
If you're hosting a
或者
small
生病，
gathering,
始终的待在家里
small gathering,。
如果你考
remember
虑到人员拒
to
绝的
keep
话
those，
那么
gatherings
人员越
small,
少越
know
好。
people who are coming and stay outside as much
如
as
果
possible.
能够待在
And
室外
also,
就待在
we
室外。
need you to have a designated contact keeper
那
so
么
that
大
we
家
can
也要
assist
指定
you
一些
and
联络
find
人。
people if you inadvertently are
如
exposed.
果你觉得
We
你
need
被
to
暴
do
露
that
病毒
now
了，那么你
so
会
that
大家
we
要找得到
can
你。
continue on our restart program. We can continue to enjoy our summer.
所以我们
and we
整
can
个夏天，我
continue
们
to
还会
recover from the
能够
effects
享
that
受
we
这个
have
夏
had
天，同
over
时
the
又是
last few
安
months.
全。那么
Help
在接
us
下来的
spread the
2-3个月
message
里
to
边，我们还
socialize
会
safely
这样能够
so
安
we
全的
can
享
keep
受。
COVID-19
所以我们
low
还会
and
这样
slow.
能够让这个
And
病
let's
毒
of
感染力
course
低。
continue to be kind,
所以他说，
to
当
be
然了，
calm,
还会
and to
3
be
个著名的
safe.
be kind， 比容让、安心和那个 安心、容让和客气啊。
First of all, I want to acknowledge that over the 3 days.
那么他说，大家都知道，在过去3天里边超过了100例。
Something that we, of course, are grateful for. And that the number of people in the hospital has gone down.
那么他说，住院的人数的确是降低了，大家都知道。所以一开始大家这么多的感染率的话，会很多人住院，这只是这个还是我们还是持续关注住院的人数的问题。
Vancouver Coastal Health in the early days of the pandemic was the center of cases.
那么他也是说到了延安卫生局疫情开始的时候，他们是中心。那么现在不是了。
Coastal Health, which tells us again we can't let our guard down. 102 cases.
所以他说，过去3天里面102例。
Terms 34 cases a day.
那么相当于334个一天。
But it is a lot more than we are comfortable with.
那么这个是很多了，我们不舒服啊，我们觉得不好，这个多了一点。
By continuing to use.
所以希望大家还是，那么我们亨利医生始终跟大家讲的，还是利用这些规则，利用这些行为准则请大家务必遵守。
In terms of the modeling today.
那么今天也是大家谈到了这个模型分析。
The reproductive rate is higher than 1. And we have to together do something.
所以我们必须协同一心，持续的努力。
More contacts, that the challenge becomes very significant to contact tracing. So we have to see that. And even if there were not a significant number of cases over the last 3 days, the fact that that rate is going up over the period leading into this time would be a cause for concern. Secondly, we have to understand that COVID-19 has affected everybody.
那么他也是说，第二是说了这个第二点呢，就是说我也理解这个病毒也是对大家每一个人造成了很大的影响。我们也是一直在讨论我们也看到了很多的这个数据分析那么持续的长期的老年人长期病对他们造成了特别的很大的影响。
In a week or so, we'll be recognizing our 6 months of briefings. I think.
那么他说，再过1个礼拜呢，我们可能会大家我们这个新闻周报新闻通报是6个月了。
And the fact that so many British Columbians have concerns.
所以我也不要再提醒大家，就是我们始终强调这些如果生病啦、不舒服啦，就待在家里等等。那么大家也看到了，就是很多BC 省民都完成了我们的民意调查。这个是
It reflects, I think, the real needs of dealing with COVID-19. I wanted to say a few things. I regularly update on Monday about PPE, and we'll do so today just to recap.
PPE 的一个汇报，因为也是3月份到现在，我们完成了多少的 PPE
Just over 6 million N95 equivalent respirators, over almost 25 million surgical or procedure masks. Just over 2,302,000 pieces of eye protection, including goggles and face shields. Just over 56 million pairs of gloves, and almost 3 million gowns. Many of these items I've just listed are in our testing process to make sure product needs meet or exceed safety requirements before being used in the BC healthcare system. Today I can tell you over the past week, we've received the following: 9,872 N95 equivalent respirators, 1,041,000 surgical or procedure masks, 4,717 pieces of eye equipment, 6,367,000 pairs of gloves, and 535,000 gowns. Today, I would also like to respond to some of the questions we received regarding how much has been spent on PPE through BC's health system. As I said previously, the international market for PPE, and by extension, the cost of PPE, has been very dynamic since the start of the international pandemic. For context, I have information on the price per unit of various types of PPE, including freight costs. The information covers pre-COVID average pricing, peak COVID pricing, and pricing in the recent period. For N95 respirators or equivalents, the pre-COVID pricing, the average unit price was 62 cents. The COVID peak pricing was between $5 and $8 per unit. The recent analysis has seen that drop between $3.19 and $6.80. That's a pre-COVID versus peak difference.
那么他也是说到了价格现在也是下来很多，本来一个单位的口罩呢是5块到8块，现在3块到6块之间，下降很多。那么都是包括其他的什么口罩啊、手套啊，都是比分值的价格下降很多。
Average unit was between 65 cents and $4.40. Pre-COVID, COVID peak pricing $2.20 to $9.65. And recent analysis has seen that drop the top part of that number, still $2.20 to $8.45. So that's 2 to 3.5 times. There weren't very significant material differences in the price of gloves or face shields in that time. Overall, from January to the end of June, the BC health system has spent over $114 million in PPE as a result of the pandemic. This consists of approximately $24.7 million on surgical or procedure masks, $29.55 million on N95 respirators or equivalents, $22.82 million on gloves, $16.93 million on gowns, $8.3 million on face shields and goggles, and over $12.5 million on other critical products such as coveralls and other products. And because it involved protecting people in acute care and in
因为
long-term
这个里边
care
有很多都是长期护理院以及这个急诊性诊疗所都要使用的，那么这些个人防护服 PPE 等等这些都是很贵的。那么3月份以后，我们的这个供应链都是修改了我们也增加了很多我们也是快速的补充了这些短缺。
As I reported every week, BC has had good success. We've kept the pace with demand and made sure that healthcare workers have the PPE they need, when they need it, and where they need it. We are currently rebuilding our pandemic supply that got us through the initial outbreak, and we are also including a healthy contingency. The province has undertaken utilization modeling to help forecast demand for PPE for the next 6 to 9 months to help inform us of stockpile targets. We have based the modeling on our ramped-up surgery plans and in anticipation of a surge or further outbreaks. Over the next 6 to 9 months, our goal is to procure PPE as follows:
或者是第二波疫情来做了很多的战略储备，这个是医疗物资的储备，不单单现在要用，满足现在要用，现在还要为这个将来的流感季新的一轮来储备。所以这个也是给大家汇报了很多的，包括消毒液的多少加仑多少防护口罩多少手套，多少这个护目镜等等。所以他说，过去几个礼拜都是提醒大家这个疫情始终在我们身边，而且数字都在上升这个对我们都是一个挑战。那么我们也给大家也汇报过这个血清抗体的调查情况，这也是告诉大家我们还是比较成功的，大家没有很大的感染情况。那么礼拜五我们给大家汇报了28个新增案例，那么今天呢又是51个是增加的，所以51个、19个、32个，那么始终提醒大家我们这个也没有结束。所以我们躲避不了这个新冠病情，我们跟这个新冠病毒是没有办法做妥协。所以我们每一天每一滴所做的都是对将来产生效果。所以我们要相互的这个关心，相互的提醒，也要遵守我们的行为指南。所以我们希望还是大家始终的保持这个社交距离、安全距离，能够拯救生命。这个是共有的这个感知。
right now using our COVID skills and making
所以
sure
我
we're
们还是
using
要
our
需要
COVID
我们学
sense
到的这些
matters
所有
a
的技
great
术
deal.
技巧
If we
就
continue
是
to
就是
remember
3个我不再
COVID-19
重复了
being
能够
outside
去
has a
面对
huge
这个疫
upside.
情
And
这
the
个是
safety
保
in
护生命
small
也是能
numbers
够
will stop the
避
spread
免这个
and
曲
will
线
save
上升
lives.
的一个最重要的
Aujourd'hui,
方
nous
法。
faisons le point sur le nombre des nouveaux cas pour 3 périodes de référence
所以
de
这个
24
数字
heures
是比较大的
chacune,
啊
soit celle des
礼
17
拜
et
5到礼拜6是
juillet,
51个
celle des 18
礼拜
juillet
6到礼拜
et
天是
19
19个
juillet, et celle
礼
du
拜
19
天
juillet
到礼拜一
jusqu'au
是
20
32
juillet
个
en
一共
mi-journée.
是3
Il
天
n'y a
是
aucun
102
nouveau
个
décès au COVID-19 durant ces 3 périodes de référence pour un total de 189 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 2858 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, nous avons eu 51 nouveaux cas. Pour la deuxième
所
période
以
de
卫生厅
référence
长
qui
现在
s'étend
是用
jusqu'au
法语来
19
跟大
juillet,
家
nous avons eu
会重复一些
19 nouveaux
上面的
cas.
话，
Au
包
cours des
括
dernières 24 heures,
BC 省
32
3月份到现在
nouveaux
为
cas se
止
sont
这
ajoutés.
个医疗物资的储备情况、采购情况 PPE 啊。那么也说到了上个礼拜采购了多少个手套、多少个医用这个口罩、手套和这个防护服等等等等。我们都统称叫 PPE。PPE 啊 ，Personal Protective Equipment。
Please unmute your phones. You will not be audible until I call your name. First question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry and Minister Dix. It's very clear from these numbers that young people gathering
他
is
说
the
这个很
biggest
清楚
issue
了，
right
这
now.
个现在就
Should
是年
bars
纪
and
轻的人
nightclubs really be
他
allowed
们
to
就
remain
是
open? And if they
那
are
么是不
allowed
是
to,
现
why
在
not
很多的酒
mandate
吧是不是允许他们
masking
这
for
么
bars and
大规模
clubs
的
like
聚
there is
集
for hair？
因为
salons
现在
and
这个
spas?
数字上升还是年纪轻的人聚集
I
引
think
起
it's a
的
bit of a challenge
他
to
说
wear a
这个
mask
呢
when you're in
如果戴
a
口罩
place
的
where
话
you're
的
eating
确
and
是一
drinking.
个
So
这
we
个
have to
很挑
remember
战的
that nightclubs
那么
per
他是
se
说
are
呢
not
这
actually
个
open
夜
in
总
this
会
phase,
说实
but
话
they are able to
没
open
有其
to
实是
have events
在这个阶段没
under
有
the
完全
food
开
forward
放
licenses
那
that
么
we have. So
包
it's a
括
bit
了
of
这个食
a
品
challenge, I guess.
执照的发放
And
等
yes,
等
we talked about this a little bit before.
我们过去
I
也
think
是谈过这些事情
we need to balance
我们
the
也是希望
impacts
这
with the
个
measures that we have
保持如何
to
保持
increase
平衡
people's safety.
这个措施也要平衡的
And
措施
yes, we
又
do
要他
have
们
COVID
安全
safety plans.
又要
And those
他们的
plans
给他
need
们
to
要
be
有安全的
adhered
措
to.
施安
And we
全的
need
计
to
划
have the means to ensure that
这个
people
安全是
recognize them
相互之
and
间
are
认
not
识
breaking those
不
rules.
要
And where
破
we've
坏
seen
这个
that
我们的
happen,
规
we
矩
have closed
规则
restaurants down, we've closed some bars and nightclubs down when they have not done it.
那
And
么
we're
如果他
working
们不
with
遵
the
守的话，我们
industry
的确
to
也
look
是
at
关闭
how
了一
we
些酒
can
吧
better
和餐
make
厅。
those plans safer, recognizing the challenges that we've seen. So what we want to do
所以
is
我们
look
所
at
要做
where
的是
these transmission events are happening more commonly and look at the measures that are important to try and reduce the spread in those
所以
settings.
我们这
So
些
we will be coming
措
out
施是不是
later
能够
this
阻
week.
止
We've
这
been
些
in the
病毒的
process of looking at it
传
for the
播
last week
我们的措施
with
是不是到位
industry, with some enhanced restrictions around how nightclubs
包括了
and
夜总会
and bars
酒吧
operate. We'll also be looking at
都看
enhancing
到了
our
他们那些的
inspections,
爆发
both from WorkSafe, if it's a worker issue, but also public health, to ensure that the COVID safety plans are being adhered to.
包括了
And
这
we've
个
been
工作的
talking
场
about how
所
we can do
等等
that.
是不是
The
完
other
全遵守
pieces
了我
that
们的
are
行
really
为规范
important around
卫生
those
规范
are, we know that when alcohol is served, that people's
他
inhibitions
说我也
tend
知
to
道
go
了
away
比如
and
说
they
酒
may
精
forget some
大
of
家
the
就
rules.
喝
And that
喝
puts
高
the
了
servers
容易
and the
忘记
people who
我
are
们的这
working
个
in
卫生
those settings
规
at
规
risk
范
as well. So we need to have boundaries
所以
around
我们
that.
可能会看到一些数据的
I
反复
believe it is better for us
我
to
们也要
work
有自己
and
的
to
边
find
线
those ways of doing things safely.
所以我们一定要
rather
考
than
虑我们
shutting
做
things
事
down
情的
blanket,
安全
because then
我
we
们可
know
能
that
也要
people
关
will
闭
be
一
going
些措
underground
施
and hiding things and be less likely to come forward with concerns, and will be having even more challenges in finding people.
所以
So
如
some
果
of the
他
things
们
that we
这
do
样
think are
破坏的话
important
呢
is
对我
making
们
sure
公
we
卫
have
系统
those
来讲
contact
能够跟踪
information
接
for
触的
people so that
条
public
件
health
工作
can
也更
anonymously
加困难
contact people and ensure that they know they're at risk if
所以
they
一定要
are.
让他们清楚
We'll
知
be
道这个
looking
风
at
险还
how
是
we
在
can use some of the apps perhaps
所
to
以我们
support
可能也
that,
考虑
and
是不是
how we
考
can
虑
do
采
that
用一些
in a way that
这个应用程
gets
序
messages
能
more
够 后一个让他们能够快速接触，第二能够把我们的信息尽快传递到他们。所以我们也不停地在调整和 何修改我们的政策和落实我们的措施。
I do. Asking for a colleague here. CTV News has received a photo that showed 2 Lower Mainland doctors attending a dinner party at a Yaletown restaurant.
那么他也是说到了 CTV 的记者看到了这个一个照片，是看到了这些医生都参加了一个在 Yaletown 参加了一个晚餐会，在7月9号包括了他们跳舞很多人。
Yeah, I can't comment on any specific thing,
我对具体的事物我不做评论。这个希望大家必须时刻小心注意，请大家遵守我们的行为规范。
This was an event where there was distancing and they came together for a short period of time. So these things happen. It's not, it's certainly not what we would expect and not what we want people to do. And we need to model the behavior that we're looking for in others. And I look to everybody to not point fingers at others, but to try and do our best ourselves and to make sure we know what we're doing, that we have our smaller groups, that we keep our distance between people who aren't in our close contact, our close connections.
所以我们一定要，如果密切接触的话，一定有产生这个病毒传染的风险。
Hi, Dr. Henry. Thanks for taking my question. Earlier today, a journalistic colleague of mine at CBC tweeted that a well-known Victoria restaurant or a Victoria grocery chain had suddenly gotten rid of all crowd control and social distancing measures. I went there because that's where I shop.
一个岛上的一个餐厅和一个便利店。也是人群聚集，他们也没有什么相对的措施，没有相互的这个安全距离，有大约超过了一个限制35人的，其实已经50几个了，包括职员等等，他们都告诉我们，他们也比较害怕，他们。但是我也在推特上也是说到了这个。
Are you concerned at this turning point that stores now may be less rigorous in maintaining crowd control and social distancing?
I have not experienced that myself, but those are the reason why we have our COVID safety plans. And employees can call
希望这个职员也可以打电话给我们，或者 WorkSafe BC 可以告诉我们，如果这个雇主们没有完全遵守这个卫生安全协议我们的卫生守则。所以我们也是希望这个是为大家是考虑安全的，所以这个是大家有责的。如果大家有顾虑，这个也是如果没有遵守卫生准则、行为准则，所以这个也是很重要的。这个现在是最好时间，我们必须要时刻小心。我们如果旅行的话也要好小心。我们也看到了加拿大其他地方到我们省来。
To do the things that allow us to have our economy, our social connections
所以我们也看到了希望这个经济活动亲情活动都要安全的情况下去做。那么如果你有安全方面的隐患或者顾虑的话，当然你可以来联系我们，或者是去联系WorkSafe BC WorkSafe BC。我们主要做的目的就是要把这个曲线拉平。
Thank you. Next question comes from Bon Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Through many briefings, off and on, you've discussed the reproduction rate, the R number, and I know a number of occasions you've said that the threshold, if you can get it below 1, that's great, and if you start going above 1, you're worried. I assume it's headed in the wrong direction at the moment from the numbers you've given us today.
他也是说到了，你每次给我们做简报的时候说到了这个数字是关键。现在看上去数字越来越大，我关心是不是我们需要往回走能够不现在是太松了是不是要往回走，能不能就是再严一点
that is my constant worry.
这个他说我是一直是我担心的问题这个我们也是这个模型看到了预测到了这个我们可能面对的情况我是觉得这个呢可能也是反反复复上上下下我们那么模型分析的数字呢可能是说我们如果这么做会产生什么效果 果
And this is all connected to our ability to do
这个也是
contact
跟我们
tracing,
的这
to
个
find
跟我们
people
的
who
跟
are at
踪测试
risk, who've
跟
been
踪能力有
exposed.
关系。
We know there's nothing that we can do to stop you from getting sick if you've been exposed.
所以如果你
And
被
what we
感染
can
了，
do
如果
is
你
prevent
暴露
you
在这个
from
传染
spreading
的
it
风险
to
上
the next
我们
generation of
什
the
么办
people
法
that
都没
you're
有。
close to. So during that incubation
所
period,
以在这
keeping you
个
away from
潜伏期
others
里
so
边
that if you
能
do
够
become ill,
还是
you won't
遵守
spread
行
it
为
to
规范的
anybody
话，
else.
那
And
么
that's
传
how
染的
we
人就
get
会
that
少。
reproductive
对，
number
这个
down
很对
again.
的。
So how do we do that?
所以
We
我
do
严
that
重同意
effectively by
伯尼医
keeping
生
our
说的。
contacts smaller.
所以
We
他说
know
我们
now
还
that
是要
we're
接触人少
traveling
一
more,
点
we're going，
我
to
们
work, we're
不
going to
要
different
到处
settings.
都走
So
来
we
走
are
去
having，
我
contacts
们
with
上
most
班就
people,
上
with
班。
more people. What we need to do is have those as safe
所以我们
contacts,
现
which
在
means
需要
keeping
大
our
家做的就
distance,
是安全的
making
接
sure
触
that
大
we
家
have our
安
numbers
全的联
small,
系大家
and
那么
if
也就是
people
说
do
第
get
一
sick,
这
making sure we
个
can find
安
them
全距离
quickly.
第二
We know
就
how to
是
do
少接
that,
触少
and we have public health teams that are doing
那
that
么我们的
now.
公
There
卫
are
系统的
hundreds of
人
people
也
who
是
have
希
been
望大家这
exposed
么
over
做
the last few
如果
weeks,
过去
and
几个
we
礼
are
拜里边
connecting with them,
那么
and we
如
need
果
your
暴露
help
过了
to
被暴露在
continue
病毒
to
中
do
了
that.
我们就要
And that's how we get
跟
that
踪接
number
触
down
他
again.
所联系
And we
接
know
触
what
过
we
的
need to
人
do, and we know we have the means to do it here in BC. So
所以
I'm
伯尼医生
confident
说
that
的
we
很对
can,
他
but
就
we
是
need to
说到
pay
如果
attention
你
to
是
it
觉得你
now.
暴露在病毒
Do you have a
过程中
follow-up
了
one?
我们什么办法都
Yes,
没有
please.
没有办法做了
On
没有任何事
Friday,
情可以做
when you were
除非
discussing
但
the
是
corona
你
outbreak
就是
or
少出去
corona
了
cases,
你不要出去
there
了
were
你就待在
35
家里
at that
14
point,
天
and you
这
said
个很重要
that there had already been there had been first generation cases and then second generation cases, and you were waiting for numbers on third. We're up to 60 cases there now.
那么他也是说到 Corona 的事情第一波那么第二波现在已经第三波已经60个人了是不是会越来越多因为这个看上去没有这个病毒没有闷反而扩出出去了
So probably not.
他说可能不是
Super spreader events tend to be
那
where
么
a single
可能不
person
是
or
一
two
种这
people
个
are
超
in
级传播者
an
没有不是
environment where they
不是
spread to lots
那
of
么超级
others
传播
in
者他说超级传播
one
者不是
generation.
这个是
And there's a number of reasons why that can happen. Someone can be very sick and have a lot of virus
那么他
spreading.
说有些人比如说病得
Some
很严
people we
重他
know
传播的病毒
for
浓度很
reasons
大
that we don't know and we can't predict ahead of time are super shedders of virus and can be very effective at spreading it to
那么他说我们
others.
现在还
This
没
is
看到一
again
个
the
超级传
balance
播
of
者
why we keep numbers low.
所以为什么
So
我们
if you,
始终
even
要
if
期
you
望大
are
家能
somebody
够
who's shedding a lot of
这个
virus,
50个人
if
以
you
下
can't
就是这
spread
个
it
问
to
题
lots of people, you are not going to get one of those super spreading events. And this is, we're at that really challenging time. But what we have seen with this, with the Corona outbreaks,
他说
are a
Corona 的爆发的情况呢
series
主要是
a series of parties,
主要是一系列的
small groups
party
that
一小
intermingle
群
so
一小
people
群
in
人
one group one night, a different
那
group
么有
another
些
night.
这个
And so it's
晚
not
上
been
有
a
些呢是
single
那个
super
呢
spreading
都是
event
一
that
个
we've
小事
seen
情一
in
个小事
some
情
other
联系起来
places,
的
but it has been a number of events
那么有
where
很
people
多
have
是
spread
一个
to a
小事
number
件
of
小
other
事件连
people,
起来的
and then they've gone on
那么
and
这
had
些人
other
再
large
传去
numbers
传
of
到另
contacts.
外
And
的
as I said,
这些人
early
再传到
on
那
in
样
this,
那
the
么小阶
average
段就
number
是
of
这样
contacts that a case
那
had
么
was
我们都
around
能够
11 or 12.
跟
We're
出
back
到
up
接触
there
到
now. We had brought it down to 3 or 4,
那么我们现在
but
也是
now we're seeing people who have contacts, 20 or 30 contacts, and that puts the pressure on us in
所以
public
也
health
是
to
说到了
find
一
those
传
people
一传
and to
一然后
notify
变成
them, make
20
sure
个
they
30
know
个
what they
所以
need to
对我
do.
们公
And
卫
quite
系统的
frankly,
工作人
people
员来讲压力也很大
are
他们
a
因为
little
要
bit
面
tired of all
很
of this.
多
They
的
wanted to go
接
away.
触
I
接
think I
触
wanted
的
to go away.
工作量
But
跟踪
we
跟踪量
have to live through this and be able to live our lives, and that means we have to be cautious.
所以
And
他说
we
我们为了
need to
自己
take
活
those
下去我们
precautions, and if
必
we
须
are
就
somebody
是
who's
小
been
心谨慎
exposed,
如果
then we do need to take
被
those
病毒
measures
传
to stay
传
away from
如
others
果
so
暴
that
露在
we're
病
not
毒中了
passing it on
那么就是要自我
inadvertently.
隔离不要再去传给别人
Next
了
question is from Farhan Lalji, TSN.
Hi, Dr. Henry. Just wanted to touch base and ask about amateur sports and a possible transition from phase 2 to phase 3.
那么他也是说到了业余体育会不会因为在第2阶段和第3阶段的时候考虑到业余体育的开放，那么这个传染情况怎么样？
I actually not sure where we are. I know some sports have
那么他说我不知道什么可能不知道我们现在的具体情况，因为有些运动已经开始了，有些运动还没开始。
But I don't have a single answer for that across the board.
我没有暂时没有对每一个运动有一个简短的回答。
Thank you. Next
没有
question
回
is from
答，
Lazy
因为
Houston,
每
News
个运动
1130.
项目不一样，所以没办法回答。
Sorry, I had to get it off mute there. I'm wondering, you mentioned about the super spreader, but like on a level of
他说你传到了，你说到了这个超级传播者。
I have to say myself and others, I think are on a level of holy, fill in the swear word of your choice right now.
Well, how about I'm at 102. That's my level of concern for today. It's so hard to know. One thing that we have learned is that we can't predict what's going to happen, and we are reacting to what has happened over the 2 weeks, 3 weeks.
他说，因为现在问题呢，主要是因为每一件事情都是2个星期，2个星期，所以如果第一波的潜伏者也是2星期，那么第二波的潜伏者也是2星期，2星期，所以过去的3星期，现在的事情都是过去3星期的反映出来。所以我们现在不知道还有多少人被暴露在病毒中了。所以我们的公卫系统的人员他们要去积极的去跟踪这些调查这些人有些人都是3星期前从科罗纳回来了回到了地陆平原，回到了这个 Victoria 岛上等等都要积极的去。所以我们所以我们现在看到了曲线有点往上走，所以我们还是必须要拉平曲线。我们要确保，如果我们自己意识到我们已经暴露在病毒中了，那么自己去测试有没有症状，自己去密切注意自己症状。如果你自己不舒服或者是不确定，那么还是要联系我们，不要再去接触其他人了。OK 的，我们来测试你。这个是我们能做的，我们可以把病毒再闷下来。我们可以阻止这个病毒的传播。你不要再去到其他的一个聚会去了，再去参加其他的趴队能够再把这个病毒传给别人。所以这些年轻的人。
And unfortunately, some people will die.
看到了很多最终就住院了很不幸有些人还会死亡。所以我们大家都有家庭我们要对家人对生命负责。那么我们在过去的大家都看到了长期护理院还有其他的人都有风险。我们要避免，我们要保卫，我们要避免这些事。
Do you have a follow-up, Lisa?
我们不要去做这些事情去。
Yes, one of the things I noticed
所以这个伯尼医生说的很对，我严重同意他的自己自觉。你如果你觉得你暴露在风险中了，你就不要再出去了，不要再去参加 party 了，你就2星期待在家里，你就要求来测试，你就联系我们你就积极的关注自己的身体有没有症状。
Is being missed there because you've mentioned many times that is key to us staying low and slow, as you put it.
Yeah, I think it's a combination of things. So it talks about people's agency and ability. So part of it is physical ability. Do I have a home to stay in if I become ill? Or what is my living situation that allows me to do that? And the other part of it is, do I have a
所以我对这个现在，所以我现在相当理解为什么美国人这个病毒上升这么快。这些人根本不当病毒一回事。不当自己生命一回事，对自己不负责任，同时意味着对别人不负责任。所以刚才这个伯尼医生给大家分析了，看到了这个3月份以来的所做的民意调查里边，有50%的人觉得自己在精神心理上会更加糟糕这个我们绝对不可理解的。我们待在家里就待在家里好了。
If I don't go into work, it's going to overburden my colleagues, and
那么他也是说到了，如果你不出去上班，如果你上班了，你可能对同事也会带来额外的负担，对不对？这个很重要。
Awareness and increased awareness for people to stay home.
所以也是希望大家能够待在家里，还是待在家里。所以这个夏天大家以为这个天气好了，病毒会杀死，的确是。但是天气好了，很多人熬不住了，都要出来。那出来在室外也没什么大问题，还会要忌讳什么餐厅啦、什么夜总会啦、什么酒吧啦。好了，问题来了。
Last question is from Tanya Fletcher, CBC.
Thank you. Dr. Henry, you said we are at a turning point. We're on the edge. So will anything change other than more urgent messaging, perhaps if we see our curve continue to go back up?
那么他说，伯尼医生，你刚才说的，我们现在是转折点了。那你有没有给我们更加紧急的比较急的这个信息给我们，让我们压低这个曲线？
Yes, we are in the midst right now of looking at what are the measures that would make a difference in those high-risk settings.
我们现在看到了我们的所得措施主要是有限变化怎么酒吧啊，这个餐厅啊，我们现在还是在关注这些领域酒吧、餐厅，主要是室内密闭环境，大家亲密接触那或者是经常待在室内，或者是在这个或者租房的地方啊，或者是这个室内的或者是这个度假村啊等等。所以我们希望这些业主们都能够这个少开放这些party数目然后更加多的限制措施，这个是我们目前所关注的。
What we are trying to do and what we have done from the very beginning here in BC was to take the measured approach so that we don't actually have to go back.
那么我们现在不希望我们还是回到原来那么严格的措施
unless it's absolutely necessary. So what we need to do is look at what are the measures that are needed.
所以我们现在还是密切关注我们所采取的措施，在整个省里边能够又是有限度的开放，又是让大家安全。我们不希望再回到什么关闭这个关闭那个
So there are things that we can do to increase the space.
所以我们希望大家能够增加流通增加室内的气通流通希望大家能够遵守我们的行为规范希望大家能够增加这个人和人之间的距离等等。
So if the root of the concern is we're increasing our connections in unsafe ways, do you think people first of all, aren't following the personal bubble rule of up to 6 people? Has that messaging been lost? And could that number change? And could we get an answer
那么他也是说到了，是不是大家因为放松了这个我们的行为规范的遵守？
那么 that's one of the things that we're seeing with this clusters of cases that we're seeing coming out of
那么大家根据看到了这个那么多的案例新生，主要是在克鲁纳那边主要是那些室内的这个餐厅的人员聚集那么就风险在那边。
So those are the things that we need to find our balance.
所以我们还是要希望能够找到平衡。
So we're going to different communities.
我们有不同的社区。
Sometimes that makes us lose sight of those measures that we were used to doing in our own home community. We have people who are traveling here from other provinces.
但是呢，他说很多的时候呢，大家忽略了这些风险，比如说家庭里边自己开 party 那么人又多起来了，那么大家密切接触的时间又多了。如果我们大家一定要时刻保持警惕我们一定在社交的时候能够把安全措施做到位，那么有安全防范的意识的话，所以我们还是希望经济在重启的时候，我们社交能够安全的继续。所以这样的话呢，我们也要考虑到我们的所有的措施是对他们有没有影响等等，这一切。那么卫生厅长来回答，因为有些是伯尼医生这是法语了。
Dr. Bonnie Henry and Health
à nouveau pour tout le monde suivre les règlements, suivre les conseils.
所以有些观众可能刚刚打开或者是观看我们的现场解说，我再把过去3天的数字给大家汇报一下，这个是比较可怕。第一，上周5到上周6是51例，上周6到上周日是19例。 上次就是昨天到今天，周日到周一是32例，3天102例，很可怕。其中有4例是它叫 app-linked case， 就是疑似案例。那么这个里边分布呢是这个1042例是在沿岸卫生局，1713例在飞沙卫生局，142例在岛上，280例在内陆卫生局，69例是北部卫生局，54例是海外得了输入的。所以呢，这个他说过去的3天在5个卫生局都有新增案例的汇报。那么这个呢，其中呢，目前为止整个 BC 省这个记录在案的活跃的案子是253例，运气好的呢，虽然那么多，但是呢，住院是16个，其中4个在重症监护。很幸运的是，过去3天里边没有新增死亡，0新增死亡案例。那么还是到了总死亡人数是189个。那么这个呢，也就是过去3天的这个给大家的这个数字的汇报情况。
C'est absolument essentiel cette semaine, ce week-end prochain et dans les
那么等这个卫生厅长好
Thank you.
那么今天的他们的新闻简报呢，就给大家介绍到这儿。那我再多说一句话，也就是我们的卫生厅伯尼亨利·博瑞在回答记者提问的时候说了很诚恳的一点，也就是说，如果一个人他有被传染、被感染的可能了，已经有这个风险了，那么对医生来讲，对他们来讲已经没有什么可干了，怎么办呢？因为这个病有2星期的传染期、潜伏期，你就什么都别做了，求求你了，你待在家里吧，好吧，你就待在家里，你什么地方都别去了。你密切注意自己，你也联系我们 BC CDC， 你也联系我们要求测试，你也密切注意自己，观察自己有没有症状，同时不要走了，这个2星期你呆呆的，不要再去接触别人了，这个是你能做到的。那么同时呢，伯尼医生原来说过50个人，为什么要50个人？因为这个50个人目的就是因为如果超过50个人的话，公卫系统它要积极跟踪联系，在24小时、48小时里边要完成95%跟踪量是达不到了，所以50个人是限值。但是这个50个人不等于是安全，不是说我只要低于50个人就安全了 ，No， 不是这个意思。所以希望大家不要再松懈，从20几个到30几个一天，这个是太可怕了这个行动都在我们脚下，卫生措施都在我们的手上，所以所做的一切都在我们身上体现2个礼拜以后的效果。好了，那个今天的 BC 省新冠疫情的新闻简报就到这儿，大家转播到这儿，我们星期3再会。好，感谢大家的收看。